one of the individuals that I think has been so incredibly forthright and testified before the House subcommittee on the coronavirus as it relates to those long-term care facilities and the rampant spread of the coronavirus is Phil Kerpen, who's president of the Committee to Unleash Prosperity and a columnist. And Phil joins us on the phone today. Phil, thank you so much for your time. And I have to say, your dogged research and all of this has been a very nice source of comfort for parents. So thank you.
Well, I appreciate that. Thank you very much, Dana. I have to admit, I have to confess to a self-interested motive for trying to get the kids back to school, because I have 4 and the oldest is 9, and they've been in the house for months here, and I'm, trying to hold it together.
Yes.
But it's pretty hard for everyone, as you can imagine. And it would be good if they could go back to school. They should be in school, frankly. And around here, all the camps canceled too, which is another weird thing, because camps are allowed under the current phase, whatever it is, rule around here, but they all canceled anyway. So it's very strange. It's a weird summer for us.
Yeah, it is a very weird time. I know here in Texas, there were some camps that reopened, and of course with a limited number of campers, and then they had all of these protocols in place. And I think the majority of everything, like 95% of everything, was done outside. So it was very different from previous camp experiences. I know that your father had contracted the coronavirus while in one of those nursing home facilities in New York. And I was so sorry to read about that. And I have been heartbroken to read so many stories. And I have a friend who lives in another state, and their parent in a nursing home facility, a very close friend, contracted it as well. And it just seemed as though that it's been so underreported, and that generation has been so underserved in the, I don't want to say just protocol, but in the care of this. You have been speaking to Congress about this, and looking at the just the data, and then also discussing solutions. Let me start with, where are we at in the wave? Because I read some reports where it says we're not even done with the first wave, and then I read another that says we're out of it, and then there are new cases and fatalities that are disputed state by state. So what's just the straight no chaser truth of it?
Well, I think it varies somewhat by region of the country. I think the Northeast, it ended a while ago. The Midwest, it's mostly over. The South and the Southwest, they never really had that big peak, that big wave like the Northeast and some of the Midwestern states did, and therefore they've sort of just been going along at this kind of low. What they did is they flattened the curve the way they were supposed to. But apparently now that's a bad thing, according to the national media. But so they might not have quite peaked yet, but that's because they've sort of been going along at a pretty low, kind of pretty flat level, kind of all along. And so, but the interesting thing to me in the national media coverage and sort of the way they talk about it and the way they report the numbers is they never differentiate between the long-term care facilities and the general population. And, we've now got, in this country, excluding the state of New York, which refuses to report the real number, 55% of all of the deaths from coronavirus are among residents of long-term care facilities. And so, if you just report the total number and you don't explain that to people and you don't tell them, well, then people in the general population misperceive the risk. They think there's a much greater risk than there really is. And meanwhile, we're not putting the focus and the attention and the resources where we really need them, which is in these facilities, which are suffering, the overwhelming burden of the disease and death. And so that, I think, has been the real problem, the real flaw in the reporting. And from a policy standpoint, I don't know if you want to blame the messaging in the media for it or just the dumb governors that did it, but I mean, we have 7 states that have about 20% of the U.S. population and over 60% of all the coronavirus deaths, New York, New Jersey, Pennsylvania. Connecticut, Massachusetts, Illinois, and Michigan, and all 7 of them have something very interesting in common. They all had some version of the policy of, as soon as a patient is clinically stable at the hospital, they transfer them to a nursing home, even if they're still infectious, and even if the nursing home wasn't well equipped to prevent that infection from spreading to other people in the nursing home. And they all had that policy for varying lengths of time. Michigan still has a variety of that policy on the books. These 21 designated hub facilities, they're still sending people there for post-acute care. And that, I think, was the biggest source of the spread in the nursing homes, because what would happen, first of all, you were sometimes seeding it into facilities that never even had it before, because, people catch this disease at the hospital frequently. And so if you have someone from a nursing home who goes to the hospital for something totally unrelated and they catch it there and then you send them back as soon as they're clinically stable, that could be the source of the spread in a lot of these nursing homes. And in New York, under the Cuomo order, Dana, nursing homes were prohibited from even testing patients that were being returned from the hospital.
Oh my
prohibited
gosh.
from even testing them. So they had no way to even determine whether they were infectious or not. And, they sent over 4,000 infectious patients from hospitals into nursing homes in New York. We don't know how many long-term care residents died in New York, because they only give us the number that died physically in the facility, which is going to be a fraction of the total, because most people are hospitalized before they die. But, I suspect that instead of being the 6,300 they admit to, it's more like 15 or 20,000 people in New York, which changes the whole national picture, because if the real number in New York is triple what they admit to, that means we're not talking about the 40% of fatalities nationally being among long-term care residents that a lot of headlines are saying, but rather 60%. That's why I keep pointing out, look, outside New York, it's at 55. I don't think New York is lower than the rest of the country.
No, not at all. And I love
the refusing to report a real number.
Yes, and I love the point that you made that it's not necessarily the size of the state, the population of the state. It all comes down to what kind of good policy was in place, because California, at first, everyone thought, oh gosh, California is going to go to the way of New York. They're making some bad decisions here, but they really corrected their course. Which it's weird for me to say this about Gavin Newsom, but credit where it's due. They corrected course and made the right decisions, and were able to curtail this. And they even adopted different policies.
They
Yeah.
had the same policy as Governor Cuomo. They said, mandatory return to the nursing home. They can't test, have to take you whether they can. They had the same policy. But when there was a huge backlash, in New York, they ignored the backlash, and they kept the policy in for 6 weeks. In California, they reversed it after 2 days. And that, I think, made all the difference, because what they did in California is they basically said, okay, we're going to need a post-acute care plan that doesn't just force infectious people into facilities. We're going to designate certain facilities to be positive COVID-only facilities. We're going to use those for post-acute care. And unlike in New York, where they had a Navy ship hospital and left it empty and didn't use it at all, in California, they parked a Navy ship hospital off of Los Angeles, and what they did, which was very smart, is they moved the COVID-negative patients out of several nursing homes in the LA area so that they could live on the ship, while the nursing homes they had been in were converted into COVID-only facilities for post-acute care, so they could move the hospitalized patients directly into those. And, it hasn't been, of course, they've had deaths. Every state has had deaths in the nursing homes. There's no perfect solution, but California has lost about 1% of their long-term care population versus, we don't know the number in New York because they won't give us a real number, but we know that Connecticut's at 12%, New Jersey's at 10%, and, Massachusetts at 9%. And so policy makes an enormous difference here. Florida's also at about 1%, by the way. So California did about as well as Florida, which is remarkable given that they almost did the exact thing.
Yeah, and with all of this, it's been I feel like we went right from winter, we had a taste kind of spring, and then we all hunkered down, came out in summer, and I really worry about our kids. I really worry about our kids because they have paid such a price. Really, honestly, I think developmentally, this is going to be something that we're going to see later on down the road after we get through it and we're sure that everything has been contained. But as it relates to school reopenings, there have been some pretty crazy suggestions that have been floating around as potential guidelines that certain states or certain districts have for reopening. But there's been some good ideas as well. And I know for people who we're talking to Phil Kerpen, who has been a great resource on actual coronavirus data, and you can follow him at Kerpen, Kerpen, because I was reading on your timeline just the other day, you were praising some of the reopening plans. What do you think is the best way to approach school reopening, and who's getting it right?
Well, I think the key thing on schools to understand and communicate is that children themselves are at a staggeringly low risk of this. This has a steep age stratification, this disease. And it's not the classic U shape that we have from the flu, where the very young and the very old are at risk. It really is a J shape, where the young are at virtually no risk at all, and the risk increased steeply starting really around age 65, and more than 80% of the deaths are above age 65. And so understanding that children are at staggeringly low risk, in fact, far lower risk of hospitalization or death than the seasonal flu, it doesn't make a lot of sense to force children to sacrifice and accept months of restriction, not having school, being limited to their homes, not having activities. We've really asked the people least at risk to, in some ways, accept the most sacrifice. And of course, 3 months for a child is like years for an adult.
Yes.
It's really put them through a tremendous psychological strain. I think that the key for school reopenings is understand that children themselves are at staggeringly low risk. So restrictions on children out of a fear that they'll be sick or hurt are totally unjustified. Anything we did from that standpoint, we would have to make permanent, because flu is much more dangerous for children every year than coronavirus is. That said, you do need to think about the possibility of community spread, particularly through the adults in the building. Now, children can spread the virus, but they're not very good spreaders. They tend to be very inefficient spreaders. Most children catch it from their parents. And so there's not a lot of risk that children are going to be the source of spread, but you do worry about the pickup and drop-off, the faculty and parents intermixing, that kind of thing. It's really more about the faculty, particularly for younger children. We think from the research out of Europe now that up to age 10 or 12 or so, children don't have the ACE2 receptors developed yet in their lungs, so they can't really develop sort of the full-blown infection, which is probably why they also tend not to infect others. The picture changes a little bit as you move up the age distribution, middle school and into high school. High school is probably more like adults in terms of their ability to infect others, and we have seen a few high school-based clusters in other countries. That said, we've seen a couple of high school-based clusters in France and Israel out of, how many tens of thousands of high schools in the world. So even there, it's possible, but it's not a very high likelihood event. My recommendation would be, I think there's a very good document from the Hospital for Sick Children in Toronto that came out yesterday that I thought was probably the most reasonable school operating recommendations I've seen so far. And basically they say don't wear masks around young children. The psychological effect of that is more likely to harm them than the health benefit they're going to get from that. You don't need to do all these sorts of over-the-top sort of reorient. But they do say, limit mixing between the classes, that kind of thing. If you can do lunch not in a big room with everyone, that's better. But limit outdoor play. The value of that is very important for children. They need that unstructured time. And most of the restrictions they recommend, which I tend to agree with, are more for the faculty and the parents and the staggered drop-off and the pickup and that kind of thing. Because especially for larger schools that draw from multiple towns, there's a risk that you could have larger outbreaks sort of, where the adults are mixing really would be the main concern.
Goodness, boys, we barrel towards fall. It seems like the days are going by rather quickly. Hopefully we can get a handle on this. And also, I worry about the kids and just acclimate them back into a sense of normalcy and routine as best we can. Phil Kerpen at Kerpen on Twitter. Always a pleasure. You've just been a fountain of information, just very straight, no chaser information, which is so appreciated. You are a treasure. So thank you, Phil, for joining us. I appreciate you.
Thanks, Dana.